Taking a live look at the North Carolina Legislative Building this evening, where the stalemate over the state budget is delaying Medicaid expansion. From wait times to healthcare deserts to higher costs, the delay is felt even by those with their own insurance. WREL's Capitol Bureau Chief Laura Leslie joins us now live to explain how the delay could affect you and your family. Laura?
Deb, when it takes effect, Medicaid expansion is expected to cover more than 500,000 low-income working people in North Carolina, but it'll have benefits even for people who aren't in the program. I sat down today with State Health Secretary Kody Kinsley to talk about why he's pushing lawmakers to either end the budget deadlock or let Medicaid expansion happen without it.
Medicaid expansion could already be in effect in North Carolina. Republican lawmakers approved it in March, but they made it dependent on the passage of the state budget, which is currently in limbo. State Health Secretary Kody Kinsley hopes they'll reach a deal this month, but if not, he says they should change the law to let Medicaid expansion take effect anyway.
Give me one sentence of authority, shove it in any other bill, and let's get this done, because we can still stick the landing on October 1, and we have got to get it done for people. Lives are hanging in the balance.
Even if you are not going to be covered under expansion, you'll still see benefits. Kinsley points to more health care in rural areas where hospitals are closing.
These hospitals and these healthcare providers are businesses. When 30 to 40% of the people walking through your front door have no way to pay, you have no way to stay in business.
Kinsley says ensuring more people will help keep providers afloat and hopefully lower costs for everyone. Hospitals have to care for anyone who comes in, even when they can't pay. They shift those costs to other patients who can pay.
When you get your bill from the hospital and you think that that number is outrageous, it's because in part you are paying for services that other people that can't pay are getting.
Expansion could also lead to lower emergency room wait times because it will help more people afford to manage chronic diseases in other ways.
We had 375 people last week sleeping in emergency departments waiting for psychiatric care. The number one reason they couldn't get a psychiatric placement was because they're uninsured. If we can get people insured, we can get them the care that they need. We can free up those emergency services for any of us.
Now, Republican leaders here at the Legislative Building did not respond to my request today for comment on this issue, but they have said in the past several days that they're not optimistic that they'll reach a budget deal by the end of this month. And they've also said recently that they are opposed to letting Medicaid expansion move forward without a budget. Deborah?
We know you'll be watching this. Laura Leslie live in downtown Raleigh. Thank you, Laura.